story, and all of us have a story. We do hope for a day when our stories will be fewer. That the kinds of stories we're telling about healthcare is not the kinds that touch the heart, as they say. We'll move to another level. So this is why we're here today. We're really looking for movement on healthcare so that we don't have to keep telling the same stories we've told for generations. In fact, the stories get worse with each generation on healthcare. Because Nigeria really does face a crisis in our moment in this journey of developing our healthcare. The country's healthcare system has provided inadequate funds, resources, consumable to face the needs of the Nigerian people. Recently, the presidency proposed a 2018 appropriation bill. And we looked at the content and it was very underwhelming. In fact, contributions to healthcare have fallen since last year. Nigeria did sign the Abuja Declaration, which we ourselves committed to ensuring that we have 15% of our national budget will go towards healthcare, because that's the kind of resources it required. As of last year, 2017, we were at 4.15%. Based on the proposal from this year's budget, we're at 3.95%. So we can talk about percents all day, but what does that really mean? We don't have enough resources to take care of the many Nigerians that we're bringing into Nigeria, that are being born. We don't have enough resources for a basic standard minimum of health care. And that's what we've been asking for. The 1% Consolidated Revenue Fund requires a basic minimum standard for health care. So you can walk into any PHC across the nation and get a basic minimum standard of care. And our folks have advocated for the National Health Act to be passed, and that took 12 years, as you mentioned. 12 years of tears, blood, and sweat for us to get that passed. And as we sit today, it's not being implemented. In September 2017, one along with 30 CSO organizations signed an open letter to His Excellency President Buhari asking for an increase to the health budget. So even if we don't get to 15% this year, let's at least get to 7.5%. We also asked for the 1% Consolidated Revenue Fund to be implemented for that basic minimum standard. As we speak today, neither of those things have been done. We don't have an increase to the health budget. In fact, we have a decrease to it. In real terms, in nominal terms, the health budget increased. The amount has increased, but when you factor in inflation, the number of population we have in Nigeria, really how much naira does one Nigerian have for healthcare? It gets lower and lower every year. We urge the government to also have open contracting for health. What that means is that it's not enough to ask for more money for health. We have to ask for transparency for healthcare, because we can get more money, which is important. But at the end of the day, how is that money spent? If we don't track how that money is spent, if there's no openness and transparency in the health sector, we'll go back to square one, where there's more money, but we have no clue where it's being spent, or how it's being spent. Judging from the proposal of the 2018 budget, we know that one, alongside 30 CSOs, have spoken to the presidency, spoken to Mr. President, but unfortunately our voices have not been heeded because this budget is very disappointing. In the last decade, we've seen a degrading in the quality of healthcare for Nigerians. We've seen that more Nigerian women are dying from preventable diseases, giving birth. Our wives, our mothers, our sisters, our daughters, for things that can be prevented. Nigeria takes pride of place among some of the worst statistics we see on immunization, vaccination, maternal mortality. And the response we've received from the federal government is, well, there are lots of things that we can do. Where do we prioritize? Our call today is for you to prioritize health. Without a healthy nation, we build nothing on agriculture, we build nothing on security. We can't build a Nigeria without a healthy nation. So the excuse of saying we're coming out of a recession, we can't prioritize health because there are other needs is a poor excuse, and we find it to be unacceptable, in fact. Because the lives of the very Nigerians that the budget and the government seeks to serve are being wasted for things that we can prevent. Fortunately, there's hope. In November 2017, the Senate mandated its Committee on Appropriation to include the 1% Consolidated Revenue Fund. That's good news. It means that the CSO's Nigerian population have been advocating for this 1% funding for health, and the Senate is doing something about it. But the responsibility cannot rest with the Senate, because after that bill leaves the Senate and goes to the Joint House Committee and the 1% is retained, it has to go to Mr. President. So Mr. President, we're raising our voices to ask for more resources for healthcare, in particular for the Basic Healthcare Provision Fund, in order that Nigerians get basic minimum standard of healthcare. We understand that there are priorities that you must focus on, but we're here to say that the health of Nigerians should be your priority. The National Assembly has demonstrated that they're listening. So, Mr. President, this message is for you. We would like you to demonstrate that you're listening and implement the 1% Consolidated Revenue Fund for a basic minimum standard of care, so that the lives of Nigerians are treasured and we don't have the stories of us leaving our country in droves to seek better health care in different nations. We look forward to your voice and your participation, sir. The Nigerian people depend on this. Thank you.